We're going to tackle another myth today. This one is fabulous news for all of you ladies using hormones. So, you may have heard, maybe even when you started hormones, or maybe doctor is telling you this now, to use the smallest amount of hormones for the shortest amount of time. But at this point, there's no age cutoff. There's no duration of time where we say we have to stop hormones. This is really great news. Hormones, of course, help us with our bone health, quality of life. It's so much, and so many women feel so good on their hormones that they don't like to give them up. And years ago, if a woman hit 60 or 65, she was abruptly taken off her hormones for fear of risk of increased cardiovascular disease. That information came again from the Women's Health Initiative, and that was when a woman was swallowing estrogen. And these were estrogens that we don't really use anymore in medicine. That plays a role there, but really the swallowing part of it was really big. So at this point, at the time I'm recording this video, there are over 20 medical organizations that all agree with the same statement. Essentially, women can use their hormones as long as they and their doctor agree. So there's no conditions or anything that would make it contraindicated to continue uh, with no age cutoff for support of bone health and quality of life. And this is as long as the estrogen or the estradiol, rather, is topical. So that's going to be things like a topical cream or a topical patch. Those are our biggies that we have there. So as long as that estrogen is topical, there's no age cutoff. We can continue that. The topical factor does not apply to progesterone. If we're using a patch or we're using a cream, we're going to be swallowing progesterone to help that. And we don't have an increased risk associated with swallowing progesterone. So don't worry about that if that question came to mind. But the great news is you don't have to stop your hormones at any particular age. It's not increasing your risk of anything, it's only helping you live longer, improve quality of life, and have better bone health. So if you have a healthcare practitioner who's encouraging you to stop your hormones based on your age, this information obviously hasn't made it to them yet. And I would really encourage you to add another member to your healthcare team and work with a hormone specialist who is up to date on the most current information. Of course, you're welcome to reach out to me as well, and I'm happy to help.